Hi there. For those of you who were just on my video a second ago, sorry, my phone kicked me off. So I just grabbed my computer. So I'm going to talk about sleep, why it's super important that you sleep really well and have at least 4 hours of uninterrupted sleep, and what you need to look at in your life if you're not sleeping well. So thanks so much for joining me tonight as we talk about sleep. I'm Dr. Glenna, naturopathic doctor, mother of 3 small kiddos, and I'm the creator of Optimal Health, a 3-month clean eating program that has been helping women with their health since 1 year. So we'll talk about that at the end and the exciting changes for March 2018. But first, let's talk about your sleep. First thing first, sleep is hugely connected with weight loss. And you will hear in any health topic, sleep, pain, healthy hormones, healthy digestion, mood, depression. Sleep is always one of the health factors mentioned. It's a very important pillar of any of those health issues. So let's talk about the reasons why. With weight loss, it's connected because when we sleep, we make hormones. One of those is called leptin, and leptin controls our appetite. So if you ever noticed, if you didn't sleep well, or you got up extra early, or whatever, the next day you will be extra hungry, because you won't have as much leptin in your body to control your appetite. So sleep helps with weight. One of the reasons it helps with weight is because of leptin. Another connection with health is anti-aging. When we sleep, we do so much cellular repair and we clean up so much metabolic debris, meaning basically garbage that is accumulated during the day, that if we miss sleep, we are not going to be getting rid of this metabolic debris during the night and recharging and waking up with repaired cells. So that is super important and happens when we sleep, when we sleep in a nice deep sleep. The next one is memory, because as I mentioned, the body gets rid of metabolic debris. Our brain does the same thing. It flushes out metabolic debris when we sleep, which is why sleep is so important in preventing dementia, Alzheimer's, short-term memory loss, etc., and why it regulates mood. So if you are worried at all about things like dementia, Alzheimer's, or you notice your memory is not what it used to be, address your sleep and listen in. In a couple of minutes, we're going to talk about what you need to look at to ensure you get really good sleep. Another thing I want to talk about with sleep is your connection with hormones. When we sleep, we detox. We detox things like estrogen and make sure we are not extra estrogen dominant. So when we're sleeping, we detoxify, we break chemicals down, we eliminate, etc. So if you're not sleeping well, you're not going to that stage 4 sleep where all the magic happens. When we detox, our immune system does so much of its work when we're sleeping, going after viruses and bacteria and destroying them and eliminating them. That happens when we sleep. So if you have a poor immune system, if you find you're aging quicker than you should, or your other people your age are aging, if you're maybe have more wrinkles, if you have more bigger bags under your eyes, look at your sleep. If you are in pain, look at your sleep. If you have a problem with weight loss, look at your sleep. So it is so connected with all of those issues. So some things I want you to look at if you can't fall asleep, or if you can't stay asleep, or if you don't find you're going to a nice deep sleep so that when you wake up in the morning you feel recharged and energized. Number 1, look at your diet. Make sure you're not missing complex carbs, healthy fat, quality protein. Make sure you're getting all of those. Make sure you're getting enough of those so that you can make the hormones we need to sleep properly. Second thing is, look at your bedtime routine. Are you going through your day and then going into your bed, hitting your bed, exhausted, but then wondering why you wake up 3 hours later, or wondering why you can't fall asleep? You're going from sympathetic, fight or flight, into sleep. And that doesn't work. We need to be in parasympathetic. So look at what you're doing 1 to 2 hours before bed and make sure you're preparing for sleep. With all the artificial light, like TV screens, smartphones, and even that we have electricity. That interferes with our circadian rhythm. Years ago, when they had no electricity, we didn't have to worry about shutting down and transitioning. It would happen. We might have a candle or a lantern, but the lights were dimmed, if you will. Next one is look and check out your thyroid function. Make sure you're getting a full and thorough thyroid workup done, not just TSH, but look at your T4. If you are anywhere at the high end or of TSH or the low end of T4, your sleep will be disrupted, unfortunately. Before you have full blown out hypothyroidism, you might have subclinical hypothyroidism and be exhibiting all the symptoms, and one of them is poor sleep. The other one is adrenals. Go see somebody if you are suspicious of adrenal fatigue, which is basically burnout, overdoing it, your tank is empty, you can't get refreshed, you can't sleep well. That will, because the adrenals support our wake cycle, we need a healthy wake cycle to get a healthy sleep cycle. So those are some things. Again, I'll run through them quickly. Why sleep is so important. It affects our weight, it affects our digestion, it's connected with how quick we age, it's connected with our risk of dementia, memory loss. And something to look at is your diet to ensure you're getting all the nutrients you need to make the hormones you need to sleep. Look at your bedtime routine. Are you just running into your bed, going to your bed, expecting to fall asleep like that when your mind and your body is still revving and on sympathetic overdrive? You need a transition to sleep. And the next one is get someone to check out your thyroid and adrenals. You may be subclinical hypothyroid. You might not be hypothyroid in conventional lab testing. That maybe you could be sitting with hypothyroidism for 10 years before you go into conventional hypothyroidism where your TSH is above 5. But you might suffer for 10 years with all the symptoms before that. And there's lots of things you can do to support your thyroid. The other thing is if you suspect adrenal fatigue, exhaustion, your tank is empty, hitting a wall, not sleeping well, not feeling rested when you get up, not handling stress like you used to, see somebody who's experienced in treating adrenal fatigue. Don't suffer any longer. It can go on for years, and it doesn't have to. You can reverse it, get treatment, take care of it, and bounce back. So next I'm going to talk about my Optimal Health program. The next month, rounding up, it'll start Monday, so our registration will start Monday. It'll start in March, the first Monday of March, but registration will open Monday. So anybody that's messaged me, I do have your names. I've got you on the list, and I will post the link to register on Monday. Some exciting changes are I have reorganized the way we are going to be looking at the information in Optimal Health. So if you've done the program and you want to come back, you are more than welcome. You will never start from scratch. You'll never have to go back and go into your first month, but it's more of a 3-month program now. I've got 12 weeks. I've got a membership site where you don't have to go into Facebook. You will log into this site. You will see week by week the meal plan. I will have a health topic that we will focus on every week, from sleep to hormones to digestion to positive mindset, stress management, etc. every week. So we'll pick one topic a week and focus on that. And you'll be able to go back into those weeks and look at them again afterwards, because once you're in the membership site, you will have full access to that. So I've taken the information over the last year, summarized it, organized it into weekly modules, if you will. So I'm super excited. It's going to be more user-friendly for participants, and it'd be easier to find the videos and go back and replay the videos that I've done for the private members. I will still keep the Facebook page opened for my private members, just for all the support and the accountability, because I see how that interaction with everybody helps everybody stay on track. So if you have any questions, just message me. And once you have done the program 3 months, then you're automatically into the lifestyle membership discount, which take full advantage of, and that keeps you accountable, keeps you on track, and you continue to get new recipes. So I will chat about that a little bit more later, but registration will open Monday. And I'm excited for those of you who've been in the program to see all the nice changes. And for those of you who are thinking or on the fence about joining us, please do. The accountability support that the other members give is amazing. And the information, I think, is really, really important for any female, especially if you are 35 or over, to know what blood work to ask for, to know what symptoms are normal or what's normal, and to know what areas in your body to look for, whether it's thyroid or adrenals. Knowing the basics, I think, is really, really important, and it can help you address early hypothyroidism, early adrenal fatigue, or severe, and start reversing it now. So it's kind of like naturopathic medicine 101, if you will, or women's health 101 is what I think optimal health is. So take care, and if anybody that's done the program wants to comment below this video and let other women know the changes you've seen or what the program has given you, please do. It is really helpful for other women to know. They might be sitting on the fence, not kind of knowing what the program's all about, and there's nothing better than word of mouth or one gal saying what it's like for them. That's the best for anybody listening. So thanks so much. I hope you have a wonderful night. And more importantly, I hope you have a really, really good sleep tonight. Take care.